My name is Linda Heltz. I implemented my integrated practice project while following the quality and safety in education for nurses competencies. During the first week, I applied the competency quality improvement by asking permission from my director and collaborating with her about the topic to be addressed. The objectives and goals were written to improve quality and safety of the obstructive sleep apnea patient within the healthcare environment where I work. I then collected evidence-based practice data with the use of informatics on the topic of safe practices with the use of opioids on patients that have the presence of anesthesia, obesity, and/or obstructive sleep apnea. SMART goals were written to initiate the project, which organized the criteria needed. With this, the objectives were in place to provide a method to achieve each goal. The project focused on steps to improve safety for patients when using opioids after anesthesia with obesity and/or sleep apnea. My goal was to increase patient knowledge on this subject. I developed a team that consists of an anesthesiologist, pre-op nurse, post-op nurse, and myself. I later added a nurse who works on policies. With teamwork and collaboration, we developed a brochure with the use of evidence-based practice data found with the use of informatics to use as a tool for teaching patient safety measures that should be applied when taking opioids. This was achieved during the second week when we were focused on patient-centered care. It was determined by means of teamwork and collaboration during the third week that the brochure would initially be offered to the patients by their surgeons. The surgery center number is included on the brochure. We also discussed that questions should be used for the first day post-op call by the post-op nurses related to this project. Prior to delivering the brochure to the surgeons were provided with safety steps outlined by the CDC to reduce the use of opioids. This was done during the fourth week. During the fifth week, 2 patients were given the brochures by their surgeon. One call was made to the surgery center inquiring about bringing their positive airway pressure device. Because not all of the patients see their surgeon within a week of their scheduled surgery, patients were advised during the day before surgery confirmation call by a pre-op nurse. The obstructive sleep apnea patients were directed to be sure to bring their positive airway pressure device with them to the surgery center for their recovery period. Brochures were provided to 3 of the patients in the pre-op area and given an opportunity for questions. The day after surgery, the post-op nurses called the patients to ask them the questions that was developed by the team. 4 out of 5 patients responded that they did comply to the recommendations, making an increase to 80% of patients who did comply to recommendations to improve their own safety post-operatively. 5 out of 5 patients commented that they felt good about the surgery center's concern for them on this subject. Because of this outstanding move in the right direction towards the safety of our patients, there was a policy and procedure added on obstructive sleep apnea. During the process of developing and implementing this project with the use of SMART goals and objectives, it was rewarding to realize that I was able to use the skills that I have learned to execute an evidence-based practice project. The information that was shared with the patients in the brochure is information that will also be helpful to people in the community and nation. There is currently an overwhelming concern in our country due to the misuse of opioids, and I feel like we are doing our part to impact our community. I was able to meet my objectives and goals, which are reflected in my journal interventions, helping me to meet my goals. This video finalizes my project.